Well, one of their favorite memories is when I had to have a colonoscopy. Watching me drink that.
The Go Lightly.
Oh,
Yeah, that's a funny name
That
they
is a-
came up for that
that's
group that where people have to.
and it's interesting because it's consistency and the color of water, but it tastes like anything but water.
I see.
You're too young to know have experienced it firsthand, but
Yeah, I haven't done it yet, but
It's on your bucket
it won't be.
list.
Yeah, it'll come up soon enough.
the procedure's a piece of cake. With all that preparation.
It's the prep. I know.
Actually, my stuff wasn't called. It was called Move Prep,
I see.
and that was aptly named. Yeah, but they stuck around for that whole. Man, that was so much fun. Are we stitching up here yet, or just
Yeah, well, almost.
almost?
So I got the what we call a little flap of skin loosened up, stop the bleeding. Next will be the stitches, and same thing. There will be a few little stitches underneath. Just a little hair in there. Couple of stitches underneath, and then a cross stitch on the outside. I think I mentioned the kind of droopy upper eyelid for a few hours.
I've already noticed that.
Yeah, that's pretty much always going to be the case when you work on the temple. Black eye is common enough. About half of the time patients will get a black eye from working in this area, and it'll set in a day or two. And then we talked about how to take care of it. We'll write you some pain medication and antibiotics to be on the safe side.
Okay.
You may get a headache the first night. It's not usually going to be more than, 24 hours or so. You're not allergic to anything?
Nope.
So the pain medication is Tramadol or Ultram, 1 every 4 hours as needed. You may not need it and find a Tylenol does the trick. If the eyelids start to swell, ice packs help with that, so keep that in mind.
Okay.
So a bag of frozen peas will do the trick. And then, what's the other thing is? Oh, and then the antibiotics are minocycline, 1 with breakfast, 1 with dinner for a week.
Okay.
On occasion, patients become dizzy with that, just like room spinning dizzy. If that happens, just stop it. It's an uncommon side effect, but I mean, we do see it once in a while. If you stop it, it's usually gone in about a day.
Do these commonly reoccur, or if you've
The
had
chance of
them?
recurrence, so there are 2 things. One is the chance of one of these, let's say the spot I'm working on, coming back. Once I have clear slides, it's 1% or less. On the other hand, you may get other ones elsewhere, and that's very common. And so when you have one skin cancer, the chance of getting another one is about 10% per year. By 5 years, half of patients will have another one. And it's not uncommon for a patient to come in and they point out, or we find another spot also. That happens quite commonly. So, and that's just because fair skin, too much sun, and some other spots on the skin can develop these lesions also. Your dermatologist will see you back every few months or so.
Yeah, she wants to do a full body scan in March.
Yeah, perfect. And then minimum recommendation is every 6 months for 2 years, and then once a year after that. A lot of times, depending on what they see, they may see you more at the beginning. But yeah, just keep that in mind.
Okay.
When these are caught early, they're totally curable, they heal nicely, it's just not a problem. On the other hand, these things will just, eat away at you and get quite aggressive over time, especially the squamous cell cancers, but really the basal cells too. They'll just eat right through
Well,
the nerves.
I saw on the web, if you Google it,
Yeah,
see some severe cases where it's like eating somebody's whole face off. Or a big hunk of their face.
yes,
But
and
that-
we see that. It is real. You'd be surprised. A lot of it's from just patients neglecting themselves, and some of it's just from the patient not getting definitive treatment.
Wow.
So the spot just keeps coming back. But that's it.
Were these both the same kind, or they were
So
different?
this is a basal cell cancer on the temple. On the chest, it's a superficial squamous cell cancer.
Okay.
But very similar, effectively. I mean, treatment-wise and everything, pretty much the same. Technically, the one on the chest, untreated, is more